So today we will discuss about the hip bone. Okay, this is one of the most important bone in the lower limb. Okay, so you can see here, this is the large bone. Okay, and this is the flat irregular bone which get located in our hip region. Okay, so you can see here this bone having three parts. Okay, one is ilium part. Okay, this part is called ilium. Okay, another is, this is called pubic part, pubis part, and another is ischium part. Okay, so you can see here the upper expanded part is called ilium part. Okay, and here you can see one cup-like structure, hollow cup-like structure is present. Okay, this is called acetabulum. So, and here another foramen is present. This is called obturator foramen. Okay, and first we discuss about the anatomical position. So the hip bone is located here. Okay, you can see this is the ilium part. Okay, and this is the ischium part. Okay, and this is the pubis part. So ilium, ischium and pubis. Clear? So first, anatomical position. Okay, so you can see here that this superior part, means ilium part, is always present superiorly. Okay, this part is called, you can see here, yes, this pubis is always directed anteriorly, anterior-medially. Okay, and this is called ischium. This is posteriorly, posterior-inferiorly. So, and this part is called acetabulum. This is always directed laterally. Okay, so you can hold it like this. So this is the anatomical position, and this acetabulum part is always covered by your four fingers. You can see here. Okay. See, this is left sided. Okay, left sided bone. You can see here this acetabulum part is lateral side, and this acetabulum part is covered by my four fingers, and this pubic part is anteriorly. Okay, if you want you can write it down here. Okay, क्योंकि ये वन ऑफ द टफेस्ट बोन है, इसलिए धीरे धीरे हम लोग को पढ़ना है. ठीक है ना. Total 43 slides is present. Okay, so जल्दी से लिखो. सब कुछ लिखने की जरूरत नहीं है, ब्रीफ छोटे शॉर्ट में लिख लो. Next, like the hip bone is present upper expanded part, it is called ischium. Okay, and here you can see the lower expanded part, an oval shaped foramen is present. This is called obturator foramen. Okay, and the part of anterior medial of this foramen, anterior medially, it is called pubis, and in posterior inferior ischium, like this. See, clear na? The three parts, ilium, ischium, pubis. Okay, then anatomical position. You can see here this line, the pubic tubercle and anterior superior iliac spine is present in the same coronal plane. This meaning here you can see this is the anterior superior iliac spine. Okay, this part is called anterior superior iliac spine. This anterior superior iliac spine, and this is called pubic tubercle. Okay, this anterior superior iliac spine and pubic tubercle are present in same coronal plane. Okay, this is the meaning of this line. So first, the acetabulum is directed laterally, and the obturator foramen, you can see here, is below the acetabulum. Okay. And this expanded ilium part is directed upward, and pubis is directed anterior medially, and the ischium is directed posterior inferiorly. And the pubic tubercle and anterior superior iliac spine is the same coronal plane. Okay. First we discuss about the ilium part. Okay. So see, in the ilium there are two ends are present. One is upper end, okay, another is lower end. Okay, one is upper end, another is lower end. This upper end is also called iliac crest. Okay, so this upper end also called iliac crest. Okay, this upper end also divided into two parts. Okay, here this part is called ventral segment because this is सामने की तरफ है ना, then it is called ventral. So this is called ventral surface, and posteriorly it is called dorsal surface. Okay, and it's having three borders. Okay, one is anteriorly anterior border, posteriorly posterior border, and one is medially medial border. So three borders are present here. One is anterior border, another is posterior border, another is medial border, and three surfaces are present. See here, this is outer or inner part. This part is outer or inner. Yes, this is the outer part. Okay, so this outer surface is also called gluteal surface. Okay, and this part is called means inner surface. Okay, so this inner surface is called iliac fossa. Okay, so this is the gluteal surface, this is the iliac surface. Okay, here another surface is present. Okay, this is called, yes, sacropelvic surface. See, so this is the upper end. Okay, this is also called iliac crest. Okay, and this is present means this highest point means this point. Okay, okay, highest में जो point है, this highest point is located L3 L4 vertebra. Okay, this surface is called sacropelvic. This surface, two ends, upper end, lower end. Okay, three borders, anterior border, posterior border, medial border. Three surface, gluteal surface, iliac surface, it is also called iliac fossa, and another is sacropelvic surface. Okay, स्केपुला बोन को बोलते हो स्टार्नम बोन. ठीक है ना, हंसने की जरूरत नहीं है, मतलब एक एग्जांपल दिया हो, ऐसे बहुत कुछ हुआ है. मार्क्स देख लेना सब लोग, इसके बाद पता चल जाएगा. इसलिए मैं धीरे धीरे पढ़ा रहा हूँ और लिखा रहा हूँ, एटलीस्ट घर जाके देखने से मतलब इजी हो जाएगा तुम लोगों को. ठीक है ना. ओके, यू कैन सी हियर दैट दिस अपर एंड. ओके, in this part anterior superior iliac spine is present. Okay, and in the posteriorly it is called posterior superior iliac spine. Okay, so in the anterior superior iliac spine two important structure is present. Okay, one is inguinal ligament, another is sartorius muscles. Okay, and similarly in the posterior superior iliac spine one sacrotuberous ligament is present here. Okay, so you can see here, so the anterior and posterior end, this is anterior end and posterior end, it is called anterior superior iliac spine and posterior superior iliac spine. In the anterior superior iliac spine sartorius muscle and inguinal ligament is attached. In the posterior superior iliac spine sacrotuberous ligament is attached. Okay, in this line the iliac crest is divided, पहले बोला था, larger ventral portion and smaller dorsal portion, dorsal segment. Okay, now you can see in the ventral portion this having three lip. Okay, one is, this is outer side na, outer lip, another is inner lip, and another is intermediate lip. So this ventral portion is divided into three parts. One is called outer lip, another is inner lip, another is intermediate lip. Okay. Similarly, in the dorsal portion also, this having two parts. One is outer lip, another is inner lip. Okay. The anterior and posterior iliac crest are termed anterior superior iliac spine. This is the anterior superior iliac spine. This is the posterior inferior iliac spine. Okay. You can see here inguinal ligament and sartorius muscles is attached. Okay. So here you can see in the outer lip first. Okay. This is the outer lip. Okay. Here three muscles is attached. Okay. One is in front of the iliac crest, means this portion. Okay. Here tensor fasciae lata muscle is attached. You can see this. Okay. And here external obliques muscle attached in the anterior 2/3 and the latissimus dorsi behind the highest point, means this portion. Okay. So here three muscles is attached. One is tensor fasciae lata, another is external oblique, another is latissimus dorsi muscle. Okay. In the outer lip. Okay, this is the outer lip. Okay, this is intermediate lip. In the intermediate lip, okay, so this is the outer lip, this is the intermediate lip. Here internal oblique muscles is attached. Okay, the intermediate lip, and another is inner lip. This inner lip is also divided two parts. One is anterior 2/3 and posterior 1/3. In the anterior 2/3, transverse abdominis muscles is attached. Okay, and this posterior 1/3 quadratus lumborum muscle is attached. Okay, so first this is the upper end. This upper end is divided into two parts. One is ventral segment, another is dorsal segment. This ventral segment is also divided three lip. One is outer lip, another is intermediate lip, another is inner lip. So in the outer lip, three muscles is attached. You can see, and this intermediate lip, internal oblique muscles is attached, and this inner lip is divided into two parts. Anterior 2/3, posterior 1/3. Okay, in the anterior 2/3, transverse abdominis muscles is attached, and in the posterior 1/3 quadratus lumborum muscles is attached. Next is lower end. Okay, this is the upper part of the upper 2/5 upper 2 feet part of the acetabulum. It is called lower end. Okay, so now borders. This is called anterior border. Okay, this portion is called anterior superior iliac spine. So this part is called anterior superior iliac spine. This is the anterior inferior iliac spine. So from the anterior superior iliac spine to anterior inferior iliac spine, it is called the anterior border. Okay, similarly in the posterior superior iliac spine to posterior inferior iliac spine, it is called posterior border, and one is medially located, another border is called, this is called medial border. Okay, so in the anterior superior iliac spine, which muscles is attached? Sartorius muscles is attached. Okay, and inguinal ligament is attached here, and anterior inferior iliac spine, rectus femoris, straight head of rectus femoris muscles is attached here. Okay, so anterior border, it extends from the anterior superior iliac spine to anterior inferior iliac spine. Okay, and attachment to the in the lower half, means anterior inferior iliac spine, here attached to the straight head of rectus femoris muscles. Okay, this portion. So this is the medial border. Okay, this medial border, this is called iliac fossa, this is called sacropelvic surface. So this medial border divided this parts into two parts. Okay, one is, so in between the two surface, it is called medial border. Okay, so this is called iliac fossa and this is called sacropelvic surface. So in between this medial border is present. Okay, and here another structure is present. This is called arcuate line. This line is called arcuate line. Okay, this is present lower 1/3 of the medial border. This. Okay, this part is called iliopubic eminence. This part, this. Okay, so you can see here iliac, it extends downward, forward and medially from the iliac crest to iliopubic eminence. This is the iliac crest. Okay, this iliac crest to iliopubic eminence. Okay, so this is the medial border. Next is surface. Okay, so there are three surfaces are present. One is outerly gluteal surface, another is iliac surface, another is sacropelvic surface. So first, iliac surface. It is also called iliac fossa. Okay, so here one important muscle is attached. It is called iliacus muscle. Okay, so see here, it is shallow concave surface in the inner aspect of the ilium, below the iliac crest. ये iliac crest है ना, इसके नीचे है, below the iliac crest. Okay, and in front of the medial border. This is the medial border. In front of the medial border. Okay, and iliacus muscles arises from the upper two third, means this portion. Okay, iliacus muscles is attached. Now write it down. Okay, now you can see here, this is anterior superior iliac spine. Okay, and this is anterior inferior iliac spine, and this is called iliac crest, this whole part. Okay, this is called iliac crest, and this is ventral segment. Okay, and this is the dorsal segment. This is the dorsal segment. Okay, this is called posterior superior iliac spine. This is called posterior inferior iliac spine. Okay, here you can see the muscle attachment. Internal oblique, extensor oblique and tensor fasciolata muscles is attached. Okay, and this is the rectus abdominis muscle, straight head of rectus abdominis muscle, and this is the sartorius muscles is attached in anterior superior iliac spine. You can see here. Okay, now the gluteal surface. Okay, you can see here there are three gluteal lines are present here. Okay, posterior gluteal line, another is anterior gluteal line, another is inferior gluteal line. Okay, so one is posterior gluteal line, another is anterior gluteal line, and another is inferior gluteal line. By the presence of these three gluteal line, okay, these parts having four muscle attachment. Okay, here one, here another, and another one. Okay, so four muscles are attached here by the presence of three gluteal line. Okay, so this is called posterior gluteal line. Okay, so behind the posterior gluteal line, you can see here this gluteus maximus muscles is attached here. Okay, this portion. So this is the posterior gluteal line. Behind the posterior gluteal line, gluteus maximus muscles is present. Okay, this is called posterior gluteal line, and this is called anterior gluteal line. So in between gluteus medius muscles is attached. So this is called posterior gluteal line, and anterior gluteal line in between gluteus medius muscles is attached here. Okay, here you can see this is called posterior gluteal line, and this is called inferior gluteal line. So in between gluteus minimus muscles is attached. So gluteus maximus, gluteus medius and gluteus minimus. Okay, so below the inferior gluteal line, here another muscles is attached. It is called rectus abdominis muscles. Okay, you can see this is the posterior gluteal line, anterior gluteal line, inferior gluteal line. Okay, so here which muscles is attached? Gluteus maximus, because this is gluteal region, so gluteus maximus muscles. Here medius, and here gluteus minimus, and below the inferior gluteal line rectus abdominis muscles is attached. Okay, Okay, now write it down, the point. So this is the outer aspect of the ilium. Is divided into 4 areas by the presence of 3 gluteal line. Okay, one is posterior, another is anterior, another is inferior. Okay, gluteal line. All these line radiates from the upper margin of the greater sciatic notch. Okay, this portion is called greater sciatic notch. Okay, you can see here all the lines are radiates from these parts only. Okay, this is the posterior gluteal line, this is the anterior gluteal line, and the inferior gluteal line. All are radiates from this greater sciatic notch. Okay, see, all these lines radiates from the upper margin of the greater sciatic notch. Okay, you can see here the posterior gluteal line meets, this is the dorsal segment of the iliac crest. Okay, so dorsal segment of the iliac crest to the greater sciatic notch, it is called posterior gluteal line. Similarly, anterior gluteal line meets the iliac crest close to the tubercle of the, this is the tubercle of iliac crest to the greater sciatic notch, it is called anterior gluteal line. Another is inferior gluteal line. Okay, upper end of the anterior superior iliac spine to the greater sciatic notch, it is called inferior gluteal line. Here you can see that the gluteal surface provides origin of the 4 muscle, gluteus maximus behind the posterior gluteal line, and gluteus medius between the anterior and posterior gluteal line, and gluteus medius between the anterior and inferior gluteal line, and reflected part of the rectus femoris between the inferior gluteal line and upper margin of the acetabulum. This is the acetabulum, upper margin of the acetabulum to inferior gluteal line. Here rectus abdominis muscles is attached. Okay, this is gluteus minimus. Okay, this is the minimus, not medius. This is the sacropelvic part. Okay, sacropelvic surface. So these parts also having 2 primary parts. One is sacral part, another is pelvic part. Okay, so this sacral part also having 2 parts. Okay, one is, this is called tuberosity. Okay, this is the ilium, so this is the iliac tuberosity. Another is, this is called articular surface. Articular surface, because this part is articulates your, okay, you can see here, you can better understand this. Here you can see, this is the lumbar vertebra, this is the sacral vertebra. Okay, so this is articulates your sacrum vertebra and from sacroiliac joint. Okay, so this is the ilium part and this is the sacrum part. So sacroilium joint is from here. Okay, अभी मेरे साथ रिवाइज करो. First we learn the anatomical position. Okay, how to hold it. Okay, hold, anyone hold. How to hold this. Okay, regarding the points, tell louder than us. नोट्स देख के बोलो क्या क्या पॉइंट्स है उसमें. So that's all about the ilium part. Okay, means upper part. See the points. तुम बोलो ये राइट साइडेड है और लेफ्ट साइडेड है यू इसको दो how to hold this bone see there are all points are present acetabulum कौन सा पार्ट है इसमें ओके सो दिस acetabulum is directed laterally तो तुम्हारा lateral set कौन सा है ओके and this foramen name is obturator foramen is below the acetabulum okay so this is your which side left side okay पीछे दो उन लोगों को दो
so this is the same foramen
yes you can pass the other look Next we have to discuss the ischium part okay this is the ischium part bones
Posterior one.
okay
So can you show this second surface is like
लोग क्या क्या देखे इसमें दिस इज द ischium part okay this having two end one is upper end one is lower end this upper end also divided ventral and dorsally okay this ventral segment is also three parts one is outer lip another is inner lip another is intermediate lip and this dorsal parts also two lip one is outer another is inner lip so and then there is three borders are present one is anterior border here anterior superior iliac spine and anterior inferior iliac spine is present similarly in the posteriorly this is the posterior border here posterior superior iliac spine and posterior inferior iliac spine is present and another is medial border okay and there are three surfaces are present one is it is called iliac fossa or iliac surface here iliacus muscles is attached this is called sacropelvic surface and another is gluteal surface so this gluteal surface having three gluteal line and four muscles are attached here okay one is gluteus maximus gluteus medius and gluteus minimus another is rectus femoris okay so this posterior inferior part okay this posterior inferior part is called ischium part okay this is the posteriorly present and inferiorly so this is the ischium part okay so the ischium part having primarily two parts one is body okay one is body another is ramus is branch of one bony structures okay bony prominence so this is the body part and another is ramus part okay so you can see here it is the thickest posterior inferior part of the hip bone consists of a body and one ramus part okay so first we discuss about the body okay So you can see this is the acetabulum, this is posterior to the acetabulum, okay. So in the body part you can see there are two ends are present, okay. One is upper end, another is lower end, okay. So this is the upper end and this is the lower end, okay. And three borders are present here. One is, see, first hold any bone in anatomical position, then you have to describe it, okay. Three borders. So this is the anterior, so this is the anterior border, another is posterior border, okay, and another is lateral border, okay. So this is the anterior border, this is the posterior border, and another is lateral border, okay. And three surfaces are present here. One is called femoral surface, this surface is called femoral surface, okay, and another is dorsal surface, because this is a dorsum, na, back side, dorsal surface. Another is, this is called, because this is the pelvic portion, that's why this name is pelvic. So this is the pelvic surface. So write it down first. This ischium having body parts and ramus part. In the body you can see upper end and lower end. This is the upper end and this is the lower end, and three surface. First three borders, one is anterior border, another is lateral side, lateral border, another is posterior border, okay. And three surface, one is, this is called femoral surface, another is dorsal surface, and another pelvic surface. So this is the upper end, okay. This portion is called upper end, okay. So it is the posterior inferior 2 feet part of the acetabulum, okay. And units, this is the, you can see here, this is the pubic bone and this is the ischium bone. So units means to articulate करता है this ischium or this ilium or pubic bone को. So this is the upper end, okay. So this is the upper end. So it forms the posterior inferior 2/5 of the acetabulum, where it is units the ilium bone and pubic bone, okay. And you can see in the lower end, this is the lower end, okay. Here one tuberosity is present, okay. This is called ischial tuberosity. Here important four muscles is attached, okay. So you can see here this upper part is quadrilateral, means four surfaces are present here, and lower part is triangular part, okay. First you have to write it down, these parts. इस लाइन का मीनिंग क्या है? मीन्स दिस इज द इलियम, तो इलियम, दिस इलियम एंड दिस इज द प्यूबिक. सो दिस सरफेस क्या करता है, दिस इलियम को प्यूबिक के साथ मतलब आर्टिकुलेट करता है, कि मतलब कनेक्शन करता है, कनेक्टिंग दिस एंड. एंड लोअर एंड में क्या है, ischial tuberosity are present, okay. So this ischial tuberosity is a rough surface and divided by a upper quadrangular part and lower triangular part, okay. So here you can see that in the ischial tuberosity four muscles is attached. One is semi-membranosus muscle, another is semi-tendinosus, another long head of biceps femoris, another is adductor magnus, okay. So four muscles are attached here. Semi-membranosus muscles is attached, okay. And below it semi-tendinosus and biceps femoris muscles is attached together, and this is called adductor magnus. Here adductor magnus muscles is attached, okay. next the borders. Okay, this is the anterior border. Here obturator membrane is present. So this is the anterior border, and this is the posterior border. Okay, here ischial tuberosity is present. Okay, and you can see here in the posterior border one spine is present. Okay, this is called ischial spine. Okay, because this is ischium part and this is called ischial spine. Okay, so this ischial spine divided the posterior part of the ilium into two fossas or two notch like structure. Okay, one is, this is called greater sciatic notch, another is lesser sciatic notch. Okay, so you can see here in the greater sciatic notch important structure are present here. Okay, अगर हिप बोन किसी को मिला ये स्ट्रक्चर तो जरूर पूछेगा. ओके, व्हाट आर द कंटेंट्स ऑफ ग्रेटर साइटिक नॉच. ओके, एंड व्हाट आर द कंटेंट्स ऑफ लेसर साइटिक नॉच. So first write it down. This is the anterior border. Okay, ये बोन थोड़ा डिफिकल्ट है. ओके, ये अपर लिम के जैसा इजी नहीं है. ओके, इसलिए इसमें तो प्रॉब्लम होगा थोड़ा पहले, बाद में रिवीजन होगा, सो टेंशन मत करो. Next you have to write it down like this. Okay, the structure passing through the greater and lesser sciatic notch. So by the greater sciatic foramen or notch, here superior gluteal vessels, superior gluteal nerve, and inferior gluteal vessel and inferior gluteal nerve. This is one muscles are passing through it. This is called piriformis muscles. Okay, and sciatic nerve, the most important structures are the first six structure. So this is present in lateral margin of the ischial tuberosity. Okay, so this is lateral border. Here one muscles is attached. This is called obturator externus muscles. Okay, here obturator external muscles is attached. Okay, so you can see here, this is, it forms the lateral margin of the ischial tuberosity, and its upper part is notched close to the lower margin of the acetabulum. This is the close to the lower margin of the acetabulum, and lodge means attach. Okay, attach the tendon of the obturator externus muscles. Okay, here obturator external muscles is attached. So next is femoral surface. So this is the femoral surface. You can see it is directed forward laterally. So this is present laterally. Okay, laterally, this is the lateral side. Okay, so it is directed forward laterally and situated between the anterior and lateral border. So this is the anterior border, this is the lateral border. In between, this surface is called femoral surface. So this is the anterior border, this is the lateral border. In between, femoral surface is present. Here two muscles are attached. One is obturator externus muscle and quadratus femoris muscles is attached. Okay, next you can see the dorsal part. So this is the dorsal surface. Okay, so it's divided by transverse groove. This is the transverse groove. Here upper and lower part. Okay, so here obturator internus muscle along with, अच्छा ये तो अभी पर समझ नहीं आएगा तुम लोग. यहाँ पर सिर्फ इतना ही याद रखो कि इट्स divided by a transverse groove into the upper and lower parts, and here obturator internal muscles tendon is attached. Okay, next this is the pelvic surface. This surface is called pelvic surface. Here obturator internal muscles is attached. Okay, next is ramus part. This is called ramus part. Okay, this is the body, whole things is called body, and this part is called ramus part. Okay, so see, this is the lower part of the body and runs upward, forward and medially. Okay, and meets with the inferior ramus. when you learn about the pubic bone, here inferior ramus is present. Okay, so this ramus is articulates with the inferior ramus of the pubic bone. Okay, and form the one conjoined ischiopubic ramus. Okay, so now write it down, the all points. This is the ischial spine. This ischial spine divided this posterior border into two parts. One is greater sciatic notch, another is lesser sciatic notch. Okay, so this is mainly the body of the ischium part. Okay, and this is the ramus part of the ischium. So here ischial tuberosity is present. Okay, so in the ischial tuberosity, these muscles are attached: semimembranosus, semitendinosus, along with the biceps femoris and quadratus femoris muscles. Oh, sorry, this adductor magnus muscle. Okay. Okay. In the ischium parts, what are things you have to learn? That these parts having two parts. One is body, another is ramus. Okay. In the body, here you can say two ends are present. One is upper end, another is lower end. Okay, and three borders are present. One is anterior border, another is posterior border, another is lateral border, and three surfaces are present. One is called femoral surface, another is pelvic surface, and another is dorsal surface. Okay. Next, we have to discuss the pubic part. Okay. This is the last part. This is the pubic part. Okay, this is present anterior medially. Okay, and it's having, you can see there are superior ramus. Okay, so the pubic part is having three parts mainly. One is superior ramus, another is body parts. Okay, body, another is inferior ramus. So superior ramus, body, and inferior ramus. Okay, so first we discuss about the body part. Okay, this is the body. You can see this is the quadrilateral part. Okay, this is the quadrilateral part. Here one is tubercle and another is crest is present. One is called pubic tubercle. This is the called pubic tubercle. This is pubic tubercle, and here pubic crest are present. Okay. So here three surfaces are present. Okay. One is, you can hold it like this. Okay, so this is the anterior surface here. Okay, one is anterior surface, another is posterior surface, another is medial surface. Okay, so here three surfaces are present. One is anterior surface, another is posterior surface, another is medial surface. Okay, now you can write it down here. It is the anterior inferior part of the hip bone and consists of body, superior ramus and inferior ramus. Okay. In the body, it is a quadrilateral and flattened anterior posteriorly. It presents the features of pubic tubercle, and here pubic crest is present, and here three surfaces are present. One is called anteriorly anterior surface, then posteriorly posterior surface, and another is medially medial surface. Okay, here you can see that this is the pubic crest. Here pubic tubercle is present. Okay, so the pubic crest is thickened upper border, okay, of the pubic, and the laterally, this is lateral end projection is called pubic tubercle. Okay, so this is the anterior surface. Okay, here four muscles is attached. One is adductor longus, then adductor brevis, and another is gracialis muscles, and another is here obturator externus muscles. Okay, so it is directed downward, forward, laterally, and here four muscles is attached. Okay, so this is the posterior surface. Okay, so this is related to the pelvic part. Okay, this is the pelvic part. So this is related to the pelvic part and related to the urinary bladder. Okay, so this is the posterior part. This is Here you can see this is the posterior surface. Here this part is related to our urinary bladder, okay, and this is the pelvic part also. And next you have to see the medial surface, okay. So this medial surface is articulated by the two bones and from pubic symphysis, okay. So this is called pubic symphysis. So this superior ramus having three borders. One is posteriorly and sharpest border, it is called posterior border, okay. It is also called pectineal line, okay. So this is the posterior border and this is the anterior border, okay, and posteriorly another inferior border is there. So the superior ramus part is having three borders. One is posterior border or pectineal line also, and this is called anterior border and this is called inferior border, okay. To see here, the posterior border, okay. This, what is the meaning in this line? It extend laterally, okay. It extend laterally as a sharp line from the pubic tubercle. This is called pubic tubercle, okay. Pubic tubercle to the posterior part of the, this is called iliopubic eminence, okay, and it becomes continuous with the arcuate line and this is called arcuate line, okay. So you can see here it extends laterally, this is the lateral side, laterally as a sharp line from the pubic tubercle to the posterior part of the iliopubic eminence, where it is become continuous with this arcuate line, okay. Anterior border, this is the posterior border, then inferior border. Here three surfaces present. One is called pectineal surface. This is called pectineal surface, okay, also called posterior surface, okay. So this is the posterior surface or pectineal surface, okay. Here another, this is the pelvic part, okay. So this surface is called pelvic surface, okay. This is called pectineal surface or posterior surface and this is called pelvic surface because this part is pelvic part, okay. And another is obturator surface because this is the obturator foramen, so this surface is called obturator surface, okay. You can see here. So in the pectineal surface, this pectineus muscles is attached here, okay. So this is the pectineal surface, here pectineus muscles is attached, okay. And this pelvic surface is related to our peritoneum part or pelvic part, okay. This surface. And another is obturator surface, okay. So in the obturator surface you can see here one groove like structure is present, okay. So here obturator nerve and vessel passes through this groove, okay. So now write it down, the all surfaces. First pectineal surface, okay. It is a triangular area between obturator crest also called this anterior border, okay. And this pectineal line is also called this posterior border. So in between the anterior border and posterior border, this surface is called pectineal surface, okay. Here pectineus muscles is attached, okay. Next is pelvic surface. Here you can write it that this part is covered by the peritoneum. It is lies between the pectineal line, means posterior border and inferior border. In between this surface is present, okay. and another is obturator surface. This is obturator surface. So it is situated between the obturator crest and inferior border. This is the inferior border and obturator crest. Okay. So here obturator nerve and vessel passes through it. Okay. You can see here this obturator foramen. This is called obturator foramen. In this foramen, all parts is covered by the membrane like structures. Okay, obturator membrane, except this group part. Okay, because here obturator nerve and vessels passes through it. Okay, so this is the obturator foramen. This obturator foramen is covered by obturator membrane, and here obturator group are present, except this part. The whole part is covered by obturator membrane. Okay, here obturator's nerve and vessel passes through this group. Okay, and last slide is acetabulum. Okay, so this is the cup-like hollow structures. This structure articulates our femur bone. Okay, head of the femur bone and from hip joint. Okay, so last slide, you can write it down. Okay.